President William Ruto says time has come for Africa to establish and maintain strong public health institutions. Ruto was speaking in Addis Ababa, Ethiopia, said during the inaugural ministerial forum by the Africa Centers for Disease Control, said the continent should also enhance its capacity to manufacture its own vaccines and stop relying on imports.
President William Ruto has called for increased domestic investment in health and robust resource mobilization for the African continent to optimally address the disease factor. Ruto, who spoke during the inaugural ministerial forum by Africa Center for Disease Control, argued that the African continent must invest in public health workforce and support institutions with skilled professionals to address future health threats and disease outbreaks.
It is even more essential to achieve health security in the face of emerging and re-emerging health threats such as COVID-19, Ebola, among others. To this end, the new public health order focuses on prevention and preparedness as key pillars in health service delivery.
We have great lessons from our response to the various public health threats like Ebola and the recent COVID-19 pandemic. We know that Africa's health challenges have become increasingly complex and require multi-sectoral approach for effective response.
The head of state lauded the appeal by the African Union Commission to governments, multilateral organizations and the private sector to support full implementation of Africa's public health order.
I further challenge ministers of health to be more innovative and more involved in the governance of Africa's CDC and its activities to make it the organization of choice to go to during disease outbreak and health emergencies.
At the same time, Ruto called for ample funding of development interests in Africa to tame the cycle of inequality. For Legends Edition, I'm Gladys Mungai.